a platform that helps connect hospitals with healthcare workers and nurses in particular. So first of all, Iman, give us the lay of the land. Just what are hospitals dealing with right now and how bad is this shortage?
Yeah, so even before the coronavirus pandemic, our country was suffering from a huge nursing shortage. Healthcare became the biggest labor sector in our country in 2018. And by 2024, we're going to be 1 million nurses short. So our demand for healthcare as a country keeps going up as our population ages and there are simply not enough workers in the health system. Now, this has become even worse now that the COVID-19 pandemic has started and the shortages are becoming very acute of workers.
So talk to us about some specific. Where are they seeing shortages? Where are you seeing the most shortages in particular?
Most shortages in particular are in urban areas, particularly in certain specialties like the ER, the ICU, and infectious disease as well. What we are seeing is a slowdown of hiring in the OR because a lot of hospitals have delayed or postponed their elective procedures. And so a lot of those OR nurses are being asked to float to the ER and the ICU.
Now, as I understand it, hiring has been difficult because you've got the situation where nurses actually can't clock the hours that they need to meet certain requirements to actually, get the certifications that they need to become full-fledged nurses. Is that the case, and how are hospitals getting around that?
Yeah, so one thing that we've done recently for nurses is we launched a first of its kind platform for continuing education units, CEUs, that are completely free for every single nurse in America. This is something we had in the works even before COVID-19, and we decided to launch it early and accelerate it because these are education units that nurses need to obtain licenses and to keep them active as well. And this is a cost that nurses were incurring out of pocket. $240 million a year was being spent by nurses on their continuing education units. And on Incredible Health, it's now available completely for free. So hopefully that helps more nurses come back to the workforce as well. Yeah.
Well, and those nurses need incentives. I mean, this is a terrifying time. It's a terrifying time to be a healthcare worker. How are you, or how can hospitals incentivize some of these folks to get back into the workforce and to do this life-saving but very difficult work?
Yeah, so this is in general a group of workers that are underappreciated and overworked even during normal times. So I think today, what we need to do is make sure that we are able to appreciate this group of people and give them whatever we can, support they can, everything from PPEs to making licensing easier to enabling them to get jobs as fast as they can.
What about the equipment shortages? We're hearing, we cover the tech industry. We're hearing, Apple is working with its suppliers to make masks and donate them. Facebook donating a stash of 700,000 masks that they had saved during the Northern California wildfires. What sort of equipment shortages are you seeing, and how are those being dealt with?
The hospital clients and nurses that we're working with are saying that there are continued shortages of PPE. Hopefully these donations do make a difference. But the main thing we're seeing among nurses on our platform on Incredible Health, which is at its core a hiring platform for permanent roles, is that there are nurses that are increasingly getting sick. That's to be expected. 8% of the COVID cases in Italy are healthcare workers, and we should expect to see the same here in the US. We also have nurses that are already in quarantine. And we have nurses that are delaying their job search and not really willing to move around right now. And they're being asked by their current employer to work longer hours. So this is an increasingly challenging time for nurses as well. And that's something we need to take into consideration as hospitals staff up.